Hi, good morning, Alan. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 7th of November 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Alan Albin.
All right, Alan. Could you please confirm your candidate number?
Yes. My candidate number is 430330230.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Tell me about a time when you had to handle a difficult patient.
In a previous role, I encountered a challenging patient who was anxious and uncooperative. I first took the time to listen to their concerns, empathizing with their fears. I then explained the treatment plan in simple terms, ensuring they understood. I involved their family for support and collaborated with the healthcare team to provide the best care possible. This approach helped build trust, and the patient's cooperation improved.
How would you prioritize and coordinate a complex patient?
I would start by assessing the patient's overall condition and identifying any urgent issues. I would then communicate with all specialists involved to create a cohesive care plan. Prioritization would depend on the severity and urgency of each condition. Effective communication, collaboration, and regular reassessment would be key to ensuring the patient receives the best care.
How do you ensure that you provide patient-centered care?
Patient-centered care is essential. I always take the time to get to know my patients, asking about their preferences, cultural backgrounds, and individual needs. I respect their choices and involve them in their care decisions. By doing so, I can tailor the care plan to their preferences and ensure they are comfortable with their treatment.
Can you provide an example of a time when you had to work as part of a healthcare team to achieve a common goal?
Certainly. In my previous position, we had a complex case that required collaboration among nurses, doctors, and support staff. I actively contributed to team meetings, shared insights, and offered assistance when needed. By working together and utilizing each team member's strengths, we successfully managed the patient's condition and achieved our shared goal of delivering quality care.
How do you handle conflicts with colleagues or superiors in a professional setting?
Conflict resolution is crucial in healthcare. When conflicts arise, I strive to address them calmly and professionally. I prefer open communication, so I would approach the person involved and listen to their perspective. I express my own concerns and seek a mutually beneficial solution. If the conflict persists, I'm willing to involve a supervisor or mediator to find a resolution that prioritizes patient care and team harmony.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Mihiraa, thank you for your cooperation. I have completed your wound assessment. Let's start by discussing the treatment you have received so far. Can you tell me what you've done for the wound?
I haven't done anything for the wound. I thought it would heal on its own.
Thank you for sharing that. Mihiraa, it's important to understand the current situation. I understand that this may be a concerning situation, but based on my examination, it's evident that the wound is infected. This infection could be due to improper treatment and can sometimes inadvertently introduce harmful bacteria, making the situation worse. Foreign particles, like dirt or debris, can also lead to infection by providing a breeding ground for harmful microorganisms. Dead tissues, if present, can serve as a food source for bacteria and make it difficult for your body to heal naturally. Don't panic, we are here to help and ensure you receive the best care. We're going to address this issue promptly.
Okay, nurse. Your words are reassuring.
Thank you. Now, Mihiraa, let's discuss the next steps in your treatment plan. First of all, we need to collect swabs from the wound to identify the type of infection you have, which will help us choose the appropriate antibiotics and treatment. We'll also clean and dress the wound, which will prevent foreign bodies from entering and causing further injury or infection. After cleaning, we will be able to find the current situation of your wound. Apart from this, you will be prescribed pain relief medication as required. I hope it is clear to you, Mihiraa. Do you have any questions or concerns?
Yes, I am concerned. My first concern is about the pain during wound dressing. I do not wish to suffer pain.
Your concerns are really valid. I will clarify them to you. Mihiraa, let me assure you that, during the procedure, we will provide a local anesthetic to minimize discomfort, and I want to also assure you that the process is relatively short and should leave you feeling more comfortable once it's done.
That sounds okay. But, will it hurt after the anesthetic wears off?
I completely understand your concern, Mihiraa. After the procedure, there might be some discomfort once the local anesthetic wears off, but this is usually manageable with over-the-counter pain relievers. Additionally, I'll provide you with instructions on how to care for the dressing, which will help minimize any discomfort and promote healing.
All right.
Mihiraa, do you have any concerns or questions about the wound dressing procedure or the pain management during it?
No, let it be. But I still can't realize, for a small wound like this, why should I undergo a swab test?
I completely understand that discussing the swab test can be a bit concerning, Mihiraa, and I want to emphasize the importance of the swab test for you. The swab test is a critical step in your care, because it helps us identify the specific type of infection you have. This is vital because different infections require different antibiotics or treatments to be effectively managed. By pinpointing the exact nature of the infection, we can provide you with the most targeted and effective therapy, which will help in your recovery. Now, let me share some details about the test process and results. The swab test results usually take about 5 to 7 days to come back. During this time, it's crucial that you follow the prescribed treatment plan to manage the infection and promote healing. Mihiraa, after the results are in, I strongly recommend scheduling a follow-up appointment with your doctor. This appointment will give you the opportunity to discuss the test results and any necessary adjustments to your treatment plan. It's a crucial step in ensuring that we're on the right track to your recovery. Do you have any concerns that I need to address, Mihiraa?
No, I understand that.
Before we proceed, I need your consent to start the procedure. It's a necessary step to ensure we're both on the same page and you're comfortable with the plan we've discussed. Do you consent to go ahead with the wound dressing and swab test?
Yes, I consent.
Thank you for your consent, Mihiraa. Let's get started with the procedure, and I'll make sure to keep you informed every step of the way.
All right. That is the end of your OET-speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.